Hello, and welcome to the Unspoken Medicine podcast, the podcast that dives deep into the hidden and often unspoken truths of medicine and its intersection into society. I am your host, Dr. Sherron Colgram. It is a pleasure to meet you, and welcome to the office. I'm so excited that you're here. I have all the feels. I'm anxious, excited, scared, nervous, but I think those are all good things to have, when you're doing something for the first time. And so today is even extra special because it is our first episode. And today, not only am I your host, but I am also the first guest on the podcast. So this is going to be great. And so today, I hope to share with you who I am, that you get to know a little bit more about me, why I started this podcast, how important it is to me, and how passionate I am about sharing with you my knowledge, but also just sharing with you like all of the people that I know and love that are amazing, that are smart people inside and outside of healthcare, that are really doing the work to make our healthcare system better and to provide us with quality care. I hope you leave inspired, and I hope that this information you can pass on to your family and to your friends and share with all those that you love. All right, so without further ado, let's get started. All right, so first question that we have here for me. So tell me about your journey with medicine. So if I start from the beginning, when I was first introduced to medicine, that would have to be with my pediatrician, Dr. Blake. He was our pediatrician for pretty much most of our childhood. And if I can remember, I just remember telling my mom the other day, I felt like we were always going to the doctors, which we probably weren't. But what I can remember is, Dr. Blake, very nice man, actually a white older male. And I just remember every time we went there, I feel like because of it probably was kind of traumatic experience now that I think about it, because I feel like um I just remember everything, like my senses of like how the building smelled when we walked in. I can like hear, you know, the sound of the music, um, the smell of the room. I can just visually see everything walking in, seeing his wife, who was actually, I guess you would say, like the manager of the office, checking us in, then going into the room, just the smell of the room, hearing the paper on the exam table. And I believe, they had like I swear, it probably was like Sesame Street on the ceiling, but I can remember all these things kind of just gearing up, preparing for him to come in the room. And then he would come in, very nice. He would be talking, and he'd be like right in your face. So for me, I felt like he had like the biggest nose, which he probably didn't, but um, little girl just like, watching everything that's happening in the room. And then, we kind of get through the whole exam. And then the last part, he would be like, okay, now I got to look into your mouth. And I was like terrified because I hated that stupid popsicle stick. Now, everybody knows it's not really a popsicle stick, but it's like, a tongue depressor. And so I just hated the feeling of that, like being anywhere near my mouth. The feeling of something being put there, it just made me like gag. I just didn't like it. That was always the last thing. And I felt like he left it to the last thing because he knew like I would just be terrified. I'd be crying, like the whole thing. It was just like a mess. So even though all of that happened, I felt like he traumatized me every time I went there. um he always like, we were sick, he'd always like give us that bubblegum flavored penicillin. So I was like, he's got to be nice because he gave us like bubblegum penicillin. So I'm like, I feel like I can help people feel better in the same manner that he did. But the only thing I wanted to add in addition was that when I grew up, I was like, okay, I could be a doctor, I'm gonna take care of the kids, I'm going to do all these things, but I am going to invent some way that you don't have to put that popsicle stick in the back of the mouth to see the mouth and gag children and traumatize us. So that was my first experience with medicine. And then my second experience would be our next pediatrician, who was Dr. Borden, another white male, middle age, but Dr. Borden was amazing. He's actually worked at the neighborhood health center that my mom was employed at. And so he was very instrumental in terms of helping me kind of engage me through medical school and giving me lots of advice on that. And he even helped me in terms of some of my projects that I had to do for my graduate studies when I went back to school recently to get my master's in business administration. So both pediatricians, both doctors, two white males. And, even though I didn't look like them, I didn't probably come from the same neighborhood as them, I always felt like I could do what they did. Like I didn't see that any difference. I just felt like they were just genuine people who wanted to help. And I felt like at the time that's all that mattered. And so I would say that my steps were ordered by and through my mom's prayer. And so, like, my whole life, basically, I've been saying that I wanted to be a doctor. And so I told my mom, and my mom was, like, amazing because I feel like she always wanted us to do to be successful and to do whatever we wanted to do. She was a very supportive, very encouraging. Like, okay, you want to do this? Okay, well, you got to make sure your grades are up and make sure you're studying all the time. So she was very, I would say she was a little extra. Like she was very strict, like in terms of my schoolwork. Like I had to be on top of my schoolwork, making sure I was getting good grades, like all the things. Like she did not play. There was never a time where I felt like, you know, I didn't have any doubt that I would be able to become a doctor. And so understanding all of that and then also understanding that I know my brain worked and that I was smart and I could do the work, I kind of leaned into that. Most of my life, I grew up in a single parent home with my mother and my two sisters. And from all that I can remember, I felt like my mother was like a magician. We basically lived a life of poverty, very low income. I feel like there were times that, we didn't have insurance sometimes. We didn't have a lot of money. We lived in this one little small actual one bedroom apartment, which my mom somehow made into kind of like a two-bedroom apartment. So it was kind of one of those ones that you had like the living room and the dining room. And then like there was like the kitchen was kind of an eat-in kitchen. And then the room in the back, which was the, official bedroom, she had all of us in there. She had three beds in there. I don't know how she fit three beds in there, but we got three beds in there. We didn't have that much clothes, so I guess we had a real small little closet and we had a chest that had all of our clothes in there. And then we had like a table with a lamp, and the table had kind of like two shelves. And so that's where I had like all of my books because I just had tons of books. I always loved to read. So my mom would buy me uh the highlights books, and I think there was like the Scholastic subscription that you could like buy different books from school. And my mom used to, as much as possible, at least give me one book, you know. But uh those were kind of the living situation we had. There were times where we had no heat, no hot water. It was actually it was dangerous a little bit sometimes to be poor because if the oil man didn't come to bring oil, we wouldn't have hot water, and then we would have to like boil water on the stove and then carry the pots of water. into the bathtub to like have a hot bath. Sometimes we didn't have food, or, of course, it might have been not what you wanted to eat. But despite all of those things, like, we still had what we needed. She also made sure we were always dressed, even if sometimes she didn't have a new dress, or she would have to wear the same dress to like church or something like that. She always made sure that we had everything that we needed. When my mother did all that she could, we also had a village around us. And I say almost like a village or a tribe of people that also helped my mother take care of us. And we were able to go to not only public schools, but we went to Christian schools. There were people that helped pay for our tuition. There are people that helped pay for our clothes. There are people that helped pay for books, but that just helped in so many different ways, that drove us to school, drove us back from school when we went to school out of state. My godmother, and I call her Grandma Davis, she was like my babysitter for a while, where my mom would go to work, and then we would like stay with her. My mom would come pick us up after. And so I almost was like raised by her. So it's like sometimes people, when they talk to me, um, they'll be like, you have kind of like an old soul. And I attribute that to her, because I feel like I was with her all the time. But she always came through. I remember one day she showed up to the house and she had groceries, like a bag, like bags full of groceries. And we were so excited that we had food. And then, like, my mom, like, when she left, my mom was like, okay, can't be eating all of the food. Like, she was like rationing it out, because we're like, we don't know when we'll have food again. So it's just remembering all those things, but also understanding that, we had people around us. We had our church family that was always there, bringing us to basketball games, and bringing us different activities and different socials. We were involved in the choir. The choir went to so many different events. We had like musicals at our church and different plays. And like I said, my mom always made sure that we looked the best that we could, that our hair was done. Those things are some of the things that I still do for myself. You know what I mean? Because my mom was like, these are important. You need to be looking your best. You need to have your hair together. You need all of those things. We were in fashion shows with I call her Auntie Zila, but Ms. Zila, who was like well known, hairstylist in Springfield. She was just like amazing. She introduced me to so many different things, just being a businesswoman, being smart, being confident, beautiful, and her skill set in doing hair was tea. So just, I feel like, just having all of those experiences, even though, as I said, we didn't have much. My mom didn't have a lot of money. We, had the basics enough to get by. I feel like I still had enough to see outside of my environment, and to see that, again, like, whatever I wanted to be, I could be. And so I just had to put my mind to it, understanding that was smart. I got good grades, like school. And I wouldn't necessarily say that it came easy for me, but um, it, I knew how to I knew how to study. I knew how to get through the work. So that helped me. I knew that I will use my brain to help me get out of my situation. That there were greater things for me. Like, I knew that I had a purpose, and understanding the vision that God had gave me to help people, I knew that I would use my brain to help others. I also had great teachers who were also part of my village. So many different teachers that just taught us to be the best that we could and to help others. I never got into trouble, because I was always studying into my books. Honestly, I just didn't want to deal with my mother. So my sister is probably about 9 years older than me, and I saw how she would uh, get in trouble, and I saw what she did, and I saw all the results of all of that, and I didn't want to deal with my mother. I was like, I'm not trying to deal with that lady. So I made sure I learned from her lessons. I always try to do the best in school. I got straight A's. I got all the good grades. I didn't think about, like, as I said, like, yeah, I'm gonna become a doctor, but I didn't think about the financial part of it. And so, like, my mother was like, okay, yeah, okay, you can go to school, you can do all these things, but I don't got no money to send you. So I'm going to just pray. I'm going to just send you with a prayer, and it's going to, however it's going to happen, it's going to happen. If God's going to make it happen, it's going to happen. I never was bad in school. So I just felt like the guidance counselor office was for kids that were bad. I never went down there because I was like, well, I don't have a reason to go down there. So I didn't understand, anything about scholarships for getting into the school, none of those things. And so, like, one day I was in history class, and I can't remember my history teacher right now. I'm blinking. So I was in history class, and I think we were like watching some type of video, and he was just inquiring because I got straight A's. My GPA is high. I was like fourth in my class. So I was on the honors, all those things, and so he was like, what is your plans? So I told him, I was like, yeah, I plan to go to college. I don't know which college I'm going to go to, but I'm planning to go to college, and I want to be a doctor and all these things. And he was like, did you apply for any scholarships? And I was like, I didn't know anything about that. And so he was like, there's a scholarship that you need to apply for. And the due date was that day. He was like, you need to go down to the guidance counselor's office, get all the information, and then I want you to sit here and write this essay for the scholarship, and we're going to get it sent out. So he did all of that. I came back upstairs. I got all the paperwork. I sat there. I wrote the essay. And then, we sent it off. Didn't really think about it. And so then came, I guess, the night where they were doing kind of the awards and had invited all of the applicants to come to the event. And it was downtown. I believe it was at the Symphony Hall. And so I went, and honestly, I really didn't want to go. One, I didn't think I was going to get it, but I was just like, I didn't want to go. I didn't have nothing to wear. I only had, like, my church clothes, and I was like, my hair wasn't done. Like, it was just so many things. But they were like, no, you need to go. You need to go. You need to go. Put your clothes on. We're going. So we get there late, and, we sit in the back, and I'm like, I really don't want to be there. And so the people are talking. So now it's time to talk about, the people that got the recipients of the awards, and, they're describing them and all that stuff. And so the person is like talking, and I'm like listening, and I'm like, that sounds like that sounds like they describing me. And so when they said my name, I was completely shocked. I was like, oh my God, I can't believe I won the scholarship. And the scholarship was through the Community Foundation of Western Massachusetts. And so it was actually a Mass Mutual scholarship. And Mass Mutual is one of the insurance companies in this area. And so I got the scholarship. I had to walk from all the way from the back. So, when people be clapping, they initially be clapping, but I had to walk the whole entire way. So, like, people had been finished clapping, I was still walking up there. So I finally got up there. I was like so embarrassed, but I was excited that I got the scholarship. It was a $20,000 scholarship. And actually, the speaker for the night was Robin Roberts. So I got to meet her, and it was really the moment. I actually received that scholarship probably 3 out of the 4 years I was in undergraduate school. So that really helped me in terms of being able to pay for undergraduate school. I worked a little bit during my junior year to cover when I didn't get the scholarship. And so, yeah, that, if I can think about that being one of the great examples of just my teachers really leaning in, seeing me for who I am and wanting to support me and make sure I had everything possible to get where I was supposed to get. That's probably one of the best examples. So I'm very grateful. I'm very grateful for my whole tribe. Anyone that's watching, you know who you are and how influential you have been in getting me to this point. And so I'm forever grateful to everything that you've done for me. All right. So the next question was, what were your barriers to getting into undergraduate medical or residency schools? Um, so outside of my physical surroundings in terms of where I lived, I had to, like I said, mentally I had to understand that, my purpose was outside of this. I had to look and envision that I can come out of the community where I lived and I could rise up to be the best that I could be a doctor. So outside of that, I would say my biggest barrier would be having the finances to get through school. Because I knew my brain worked like everyone else's. It was just, how I was going to get to the starting line basically with everyone else. And I would say that because of that, that's where I use my brain. As I said, I applied for so many scholarships. So, the Mass Mutual scholarship was like one of many scholarships that I applied for. I applied for tons of scholarships. And so that's where I kind of got really good at writing. There's a message in that because I hated writing, but now I'm really good at it, not because I feel like I'm, gifted, but I just feel like because I did it so much, I got good at writing. So I feel like sometimes when we look at people in terms of, oh my gosh, they're like, the great people out there that are doing, all kind of different things in terms of speaking and writing and things of that nature. It's not necessarily that they're better than you. It could be just that they were consistent and dedicated to doing it and they did it multiple times. So sometimes you just got to do things over and over and over again. And then at some point, you're going to be efficient in getting it done. I guess another example I can give is that when I was in medical school, have to decide kind of what specialty you want to be, like what kind of doctor you want to be when you grow up. And so once you decide which specialty you want to pursue, then you have to apply to the residencies. So this was back in 2004, 2005 is when I graduated, and I had to apply for OBGYN or obstetrics and gynecology residency. And as I said, I didn't have any money. So I'm like, I don't know how I'm going to apply to all of these schools. And so at that time, like I said, I got really good at writing, applications, writing essays for scholarships. And so I had applied for a scholarship, which paid for the fee for me to apply for their first 10 residency programs. But other than that, I didn't have money for them. Now, in 2009, based on the NRMP report, which stands for the National Residency Matching Program, there were 245 OBGYN residencies in the United States. And so typically they were recommending that you apply to about 35 residencies. Now, if you were doing like general surgery, I know people were applying like to like 50 to 70 residency programs. But as I said, I didn't have any money to apply because once you go past the 10, then I feel like it was another set for the next 10. And then after that, it was a certain amount. So it can get really expensive, but I didn't have the money for that. So if you put in a calculation that I only had the 10 residencies to apply for out of 245, if I do the calculations, I had probably about a 4% chance of getting into residency. And like, that's just crazy. But I was like, I had to go on faith, right? I had this purpose. God gave me a vision that you're going to help people. And I wanted to be a doctor. And I'm like, well, listen, if God's going to get me there, if it was meant for me to do that, then I'm going to get in. And so I applied and I matched into one of the top residency programs, well, top ones that I picked out of the 10. I say all of that to say that when something is for you, it's for you. Like, there is nothing that is going to get in the way of your God-given purpose. Um, so, so yeah, that's my answer to that one. Okay. Do you regret going to out of state school? I guess that question comes because I think in-state school probably costs less. But no, I don't have regrets in terms of the schools that I picked for graduate, undergraduate. I wanted to go to HBCU or historically black college or university. I don't think there were any at the time in Massachusetts. Now, if there is some now, I didn't, there might be, I don't know. But at the time, I didn't think there were any. And I just wanted to be a part of a school where they supported Black excellence. I wanted to kind of experience that like different world effect. I just wanted to see how college life would be, living in a dorm and all of those things. I went to Oakwood College, which is now Oakwood University. And I'm so excited that I went there. I'm so grateful that I went there. I have so many lifelong friends. Shout out again to the village that drove all of us crazy kids in a van from Massachusetts to Alabama, so that we could go to what they call it college days, which was a weekend where all of the high school students came to tour the campus and just got to experience it. And the motto for Oakwood College is enter to learn and depart to serve. And just based on the experience that I had when I went to college days, it just resonated with me, like in terms of the brand for myself that I wanted to have for myself. I just felt like I knew going away from home, first time being away from home so far, I felt like my faith would be tested in any, environment that you're away for the first time from home and you're learning. I knew that my faith would be tested, and I wanted to be in an environment where I would be supported and that I would stay encouraged and also focused. And then when it came to applying for med school, Loma Linda University was my top choice. Basically, it was like, to me, it was almost like the Mecca. Like, how I heard all the great things about going to Loma Linda. So to me, it was like, and I had several friends that were going as well. And so I wanted us all to like stay together. I was like, there's no other choice. Like, there was no other choice. And if I didn't get into Loma Linda, then we would figure something else out. But I was like, that's just where I'm going. Like, again, I felt like I just have built up this confidence that, like, okay, I got to where I want to go. I'm doing this. Like, I'm on the right path. That God has put me on, and like, this is where I'm supposed to be. I already know it. And their mission is to make man whole. And so I felt like this was probably my first time being introduced to that biopsychosocial model in terms of seeing our patients and treating them as a whole person. And what did I want to say? Loma Linda is kind of affiliated or associated with the Seventh-day Adventist Church. However, at the time, there was a large majority of faculty and medical students and doctors who were not Adventists. And so I appreciated that because I felt like it just spoke to the culture of the institution. Also, Loma Linda was in sunny California, so it was like a win-win situation there. Okay, and next question. What is the best advice you were giving and who gave it to you? So again, as I said, one of my favorite doctors in the world who gave me the best advice would be Dr. Borden, who my mom worked with at the neighborhood health center. What he told me as I was going to into my clinicals, so like the third year of medical school, that every specialty that you're going into, I want you to act as if that specialty is what you're going to do for your rest of your life. I think that was the best advice to give because he didn't want me to look at the people that I was working with because it's very easy to kind of, for example, go into, let's say pediatrics, because that was what I was thinking when I first went into medical school. So going in and going into the specialty of pediatrics and loving all the people that you worked with, but you didn't love the actual specialty. And so not to get it confused, make sure you love the actual specialty, love actually working with the patients, love the medicine that you're doing, not the people that you're working with, because those people can always change. And so that was the best advice that I got. I went into medical school thinking I was going to be a pediatrician, then kind of switched over a little bit into medicine pediatrics, so med peds, and then graduated and matched into OBGYN program. What would be your best advice for birth preparation? I would say my top advice for anyone that is going to have a baby, I would say that you need to get mentally and physically prepared for the labor process. I think we focus a lot of our time in terms of thinking it takes 9 months for the baby to develop and, the baby to grow and all the things. And all of that is true. But I also think that 9 months was given for us as women having children to prepare our minds and to prepare our bodies physically for that birthing experience. For many women, it's going to be the most exhausting, physically exhausting, mentally exhausting thing that you will ever do in your whole entire life. So I think that we need to put more emphasis on women really preparing themselves for that birthing process, making sure you are you're being more physically active, um, making sure that you have the right people in the room with you to prepare you for that birth experience. And if you have access to it, get a doula. Like, I feel like everyone should have a doula, but that's definitely a plus, definitely a bonus in terms of keeping you calm, keeping you relaxed, keeping you focused in such a vulnerable time. Oh, I knew there was another one. And typically, the position that you got pregnant in is probably the position you're going to push your baby out in. Did you ever think of quitting medicine? Uh, I would say, I would probably say yes and no. I think our bodies protect us from anything that's new or we feel like it's strenuous on us. So I feel like after, I think it was probably like second year, sophomore year in college, like it was a lot because I feel like I was just getting into like the main biology courses. We had like tons of finals. Like it was like a lot of stuff happening. And I remember I stayed up for probably like 2.5 days, 2 days. I probably stayed up for like at least 2 days straight. Didn't sleep because I had all these tests to study for. we had like, this big final project that was due. It was just a lot happening, and then I crashed after that. And so I was like, well, if I'm having such a hard time, um, and I'm so stressed about studying for like undergraduate, like, how am I gonna like deal with medical school? But I think it was like a time where I was like super fatigued, and I was like, well, one girl, we're not gonna do this again. Like in terms of procrastinating, like studying this way. I'm probably gonna study hard, but I just thought sometimes you will let your emotions kind of get in the way. And so when I was well rested and all the things, I was like, okay, if we're gonna do it, this is a time where we're gonna shift and go to something else. There was just nothing else that I wanted to do. Like when I really thought about it, I'm like, yes, this is hard. What I want is hard. And if these are the things that I need to get through to get to where I want to be, then so be it. Like, again, if I gotten through all these things, you know, God has gotten me this far. Like, He's not going to leave me. You know what I mean? So just keep pushing, basically. If I go further now into my professional career as a medical student, resident physician, attending physician, I think we work in the position where we're in the midst of the balance of life and death, where we see people. We see people in very vulnerable situations, and we take care of them in very vulnerable situations. Um, And so it's always disheartening. It doesn't feel good when you have a complication or there's an outcome that you didn't want to happen with your patient. Sometimes you can do everything that you were trained to do to take care of patients, and you still get caught in the cogwheel with everybody else. And it just doesn't feel good. It's almost kind of what they call that second victim syndrome. Um, but I think you have to take the time to, yeah, you're gonna be in a dark place. You are gonna question yourself. You're gonna question, um, you know, should I be doing this? Am I a good doctor? Am I smart enough to do this? All those things. Um, and one of my favorite people in the world kind of says something to, you can look at the darkness, but don't stare at it. Like there are going to be things that happen that you have no control over. And those patients, those families, they never leave you. Like they're always with you. But, if we stop doing what we were called to do in healthcare, we would never take care of those patients that we had after those events, or after we had those complications. And I feel like in everything in life, I think you have to learn the lesson, whatever the lesson is in that situation. You learn it and you keep moving. And sometimes you just have to really encourage yourself because, even the people that you think that are around you, your colleagues that you feel like should be encouraging you, they're not unfortunately going to encourage you. And you have to encourage yourself. You have to tell yourself that you are smart. You have to tell yourself that you are a good doctor. You have to tell yourself that you have a purpose. And your purpose is to continue doing what you can do and try, every time you see a patient just to be your best self. Sometimes we have bad days, but I think that I guess what I would advise just to continue to be your best self, to continue to do your best for every person that you see, for every patient that you see. Just to bring the environment up a little bit. What brings me happiness these days? So I say what I'm involved in right now, what I love to delve into is watching sport, particularly football. Anybody that knows me knows I love football. I am over the years, I feel like I've become like a football fanatic. Like I watch a lot of football, and of course, my favorite team is the New England Patriots. I feel like I grew up in the era of greatness. I grew up in the era of winning with like Tom Brady and Belichick, and I love Tom Brady. So it's exciting that I got to be on the winning team for so long, and now it's still good for us Tom Brady fans that we still get to see him now as a sportscaster. So that's exciting. But I love a lot of the players individually. Like, of course, I bled green for a while because I did live in Philly when I went to residency at Drexel Hahnemann University. I cheered for the Eagles as well. So I like a whole bunch of people. I love the sport because I feel like these are all people that put themselves physically in the best position as possible, and they train so well to be winners. And so I just like watching winners. I guess that's probably what it is. And I watch a lot of sports shows. I watch Molly on First Take, Stephen A on First Take, all the crew on First Take. I watch Nightcap with Unc and Ocho Cinco. My sister has got me into watching more basketball, definitely watching more women's basketball. So I don't know as much, but I'm getting better. And of course, Celtics fan for sure. So those are the things that I really like to delve into. I love to read. I feel like I wish I could read more. Like now I've been reading a lot of medicine, but I just want to get to reading other things. So I joined a book club, but now I'm behind. So I need to figure that out, how I'm gonna catch up. I'm probably not gonna catch up, but I just need to read more. So that's one thing I'm working on. I love the arts. I love theater. I'm trying to become a Broadway connoisseur, like at least try to go to at least 2 Broadway shows a year. That's my plan. Um, so I need to figure out where my next one is, but we went to see um what did we just see recently? We went to see The Wiz. No, Wiz was last year. Recently we just went to see The Sixth. Um and so those were both great. I recommend that everyone go see them. I'm probably gonna go see The Wiz again when they go on tour. So yeah, those are the things I like. Other than that, I would say I'm definitely like a extrovert introvert. I don't know if I'm saying it right, but I love having my own time and like space to think. And I think I'm re-energized just by being alone and have my own like space to like breathe and think and all of those things. Recently, I've been spending a lot of time with my mom. She had a few health setbacks. Um, but it was really good being able to just spend more time with her just because I've been gone for so long. Like, I've been all over. I've probably been everywhere except for the Midwest. But it's good to like come back and kind of spend time with her. And I don't take those things for granted. Being able to talk with her, being able to hang, being able to laugh with her. Those are really great moments. Yeah. Okay. Oh, what is this question? You recently made $1,000 medical mistake. Tell us about it. Okay. So I had to go see a specialist for some abnormal blood work that my doctor had did. Um, and so I went to see the specialist at their office, and they did their workup, blah blah blah, and they recommended that I get blood work done. And it actually was a rheumatologist. Now anybody that's ever been to a rheumatologist, they when they order labs, it's almost as long as a CVS receipt. So uh, he ordered all these labs to get done, and I'm like, okay, let me go get these labs done. And so they're like, oh yeah, the labs are like right across from the doctor's office. So I'm like, oh, okay, I can just easily just go get all the blood work done. So I go get the blood work done, blah blah blah, fine, whatever. A few weeks later, I get this crazy bill, and I'm looking at all the blood work that I had done, and it came up to like a little under $1,000. And I was like, oh my God, like why am I getting this bill? Like my insurance should have paid for it. Well, no. So yes, the provider was in network, But the facility where the blood work was done and where he sent the blood work, which was through the same system, that was not one of the how do you call it? One of the preferred lab facilities to get the blood work done. So because it wasn't one of the preferred facilities, I had to pay for the whole thing. Now I was so devastated. Now, yes, I had $1,000 in my account, but devastated that I had to pay $1,000. So I just couldn't. I just couldn't. Just thinking about it right now, it's stressing me because I couldn't just fathom just paying out $1,000 to these people. So I put myself on a payment plan. I said I can't give them $1,000. So I paid them $100 per month for it was a little more than $100. So I made it so that the full amount was paid out by the end of the year. And so the insurance that I had was the HMO. And then if you know anything about the HMOs, they have like their own preferred providers. So you have to stay within those preferred providers. So if you go outside of them, then you have to pay extra money. So let my $1,000 mistake be the lesson to you. Please make sure you check that wherever you're going, whether it's the doctor that you want to see, whether it's the facility that you're getting blood work done, whether it's the facility that you're getting your x-rays or anything like that done, please make sure that you know if they're one of the preferred providers or they're out of network providers. Some insurances have these companies where you can call and you can ask them how you can reduce your costs so they can help you look up some of the flex providers in the area and tell you, okay, this one is covered, or if you go here, your lab work is free, just based on whatever your insurance plan benefits is. Um, your benefits plan is just as important as your insurance card in terms of understanding all of the details. That is really important. So I would say make sure you print that out. Make sure you have a copy of that. If you don't, your insurance company can send you a copy so you can have that so you can understand like what you're paying for and all those things. Okay, so this question: how has your personal journey with medicine changed the way you practiced? I am a germaphobe. I have been a germaphobe my whole entire life. And specifically, I hate public restrooms. My senses just kind of get flared up, like the smells, the visuals, the 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 audio, just everything just it's just really bad for me. And I've been this way my whole entire life. My whole entire life. I've been this my whole entire life. And so I have difficulties going to public bathrooms to go to the restroom. And so my whole entire life I've done basically a lot of, I guess what you call it, like avoidance. So there's actually a name for that. It's called, what's the name? It's called toilet phobia or contamination OCD. OCD stands for obsessive compulsive disorder. So common obsessions of people who fear toilets are they're afraid that there are like germs on the toilet that will cause me to get ill. We kind of focus on how many people have used the toilet. What if I get splashed by the toilet water? What if the toilet has some deadly bacteria on it? What if I get an STD from using the toilet? And so common triggers for people that have this toilet phobia or contamination OCD, where we focus on fear of toilets, include seeing a dirty toilet, seeing a toilet overflow, bad smells in the bathroom, seeing people use a toilet stall and then they come out and they don't wash their hands, just public restrooms in general. Anything like any feeling of needing to use the bathroom. Like, seriously, if I could levitate through the whole bathroom experience without touching anything, I absolutely would. So, to avoid using public restrooms, I just basically wouldn't drink. Like, I wouldn't go, but I just wouldn't drink a lot of water in general. I know that if I drink, I'm gonna have to use the restroom, so I would avoid it. If you know that you're avoiding water, you need water for your system, right, to work. So basically, I was avoiding water, and therefore, I was constipated. And so I was chronically constipated my whole entire childhood. So fast forward to about a year and a half ago, I started to have pelvic pain. And so I'm an OBGYN. So I'm going to go to my OBGYN. We're going to check for all the things, make sure we rule out everything. I was also having bladder symptoms. Talking about the bladder symptoms, like I said, if I'm avoiding going to the restroom, I've been doing that my whole entire life. Like, so even I would do that all the way through school, residency, working as an attending, like I just would avoid using the bathroom, public restrooms. So I'm holding my bladder, right? Because I don't want to go to public restroom. So I go see my gynecologist. She checked everything. She's like, everything looks fine. Nothing's wrong. And then I'm like, no, there's something happening. Something's wrong. So then I went to see a urologist. And so I saw them and he said, I don't see anything wrong with the organ system. But when we were talking through everything with him, we were like, okay, this is probably musculoskeletal. Um, you have a lot of lifestyle modification that you need to do to kind of help your pelvis. So, making sure you drink water. It's normal to drink at least several liters of water a day. It's normal to empty your bladder every few hours. Like, you have to do that. And we talked about, like I said, nutrition modification. And then he was like, yeah, so do all of that. And then, we can come back and reassess in a few months. And I'm like, no, we can't reassess in a few months because I'm like in a lot of pain. By this time, I'm probably like 6 months in terms of having this pain every day, not knowing what it is. And I'm like, no, I need to get some help. So, again, I'm using my own knowledge, from medical school, from residency, from as an attending. I'm like, okay, what's happening? What could it be? What other modalities can we use to kind of figure out what's happening? And so I was the one to recommend going to a pelvic floor therapist. So he was like, okay, yeah, we can do that. So he gave me the referral for that. Again, this is still during the time that I have this crazy insurance, HMO insurance. And I had to wait at least another like 6 to 8 weeks to get in to see a pelvic floor therapist that was covered by my insurance. And so I'm like, I can't wait. Like, I'm in like a lot of pain. I don't know what's happening. So I actually spent my own money and paid out of pocket to see someone that was outside of network. And so I saw her and we kind of figured out what was happening, where the area was, because my pain is more left-sided, and so we kind of went through the whole thing, in terms of different breathing modalities to help the pelvic floor. We even discussed a pelvic wand to help with trigger points in the pelvis. I was still working out because I was going to the gym. So I was still doing all those things. I finally got in to see the pelvic physical therapist that was covered by my insurance. And we still continue to do certain things. But like I'd go to the gym and then everything would get flared up. I'd go see her to kind of do the manual therapy. And when I go back to gym, I'd be flared up again. So it was kind of this cycle that we never got kind of past that. Because even though she gave me exercises to do, I felt like I was almost regressing. I literally remember one time telling her that, like, I used to get deeper into my squats or I can't go as deep into my lunges. that I was before. And, she was just like, just still do the exercises. And so I was just like, I need something else. I need to go see somebody else because I felt like I got as much as I was going to get in terms of the capacity of their knowledge. I was like, there's got to be something else. I had a reflux or airway reflux, like heartburn before, but I was just like, my gut was just off too. And I'm just thinking, okay, what was I doing at the time? Like, I had to like go back, like, what's happening, Sherelle? Which can be just flaring up everything. And so the only thing I was doing every single day was taking my birth control pill. And so I was like, okay, maybe this birth control pill is causing some effect to the pelvic floor and may also be causing me some of this GI upset because certain things that I used to eat, I just couldn't eat them anymore. So I was like, I'm going to stop the birth control pill. Now I'm going to break and say this is a informational podcast, so I don't want nobody just stopping their birth control pill without talking to their provider. Okay, I'm my my GYN, my primary GYN. I need you to if you want to do anything with the medications that you're on, definitely talk to your provider about it. Okay, now I'm going back into the story. So I decided to stop it. And, she definitely got me through some good years. And I had been on it for 20 years. So I was like, okay, maybe this is definitely probably causing something that's happening, but everyone's telling me I'm fine. Everybody's telling me like there's nothing. Like, and I'm like, there's gotta be something else. So I found Dr. Sonia Balani in New York. I went to see her, told her the whole story, told her everything that I was doing. She did the full pelvic assessment, including a Q-tip test. And she's like, oh, yeah, definitely. Like, you have some tissue changes from being on the birth control pill for so long. So she put me on topical estrogen testosterone cream to use in the vulva area. And then I was just like, there's just something else. There were certain positions I couldn't sleep with. So I went back to see her and she was like, okay, no, now I need you to go see another specialist. So if you can imagine, I've seen all these specialists, like, and it was just very overwhelming that we weren't finding the root cause of it. But Dr. Balani was, um, she listened to everything I was saying and she was like, we're going to figure this out. And just to hear her saying, I don't know all of it, but we're going to figure it out. And I'm going to send you to the specialist. But if you don't like him or if he don't figure it out, you come back to me and we're going to figure it out. To be validated by her was just so important in terms of my recovery and knowing that I was going to get better and that it was going to take time. It already had taken we're now almost like a year now in. But I knew that working with her, we would figure out what was going on. So I finally got up the nerve after probably like another month to make an appointment to see Dr. Sieferman, who specializes in physical medicine and rehabilitation and pelvic pain medicine. So went to finally see him, and I love Dr. Sieferman because as I'm talking to him, I can see like the cogwheels in his brain ticking as I'm talking, like he's kind of computing what's happening. He wanted me to get several x-rays and MRIs just to kind of see what was happening. We did do some diagnostic blocks into the sacrum at the time with a needle just to see if that improved some of the pain. And so, as I say, diagnostic, but also therapeutic, because if it worked, then he would have known. Basically, looking at all the nerves within the pelvic floor and if any of them were being compressed or irritated in any way. And so by this time, we're probably getting close to the end of the year. And again, I'm spending, I spent a lot of money to see all of these providers to get this far. Because of the insurance that I had, most of these providers were not covered. They weren't not preferred providers. I decided to change my insurance so that I would be able to see some of these providers that are out of network, because there was no one in my area that I knew that understood what was happening. And then at this point, I found doctors who spoke the same medicine that I wanted in terms of finding what the root cause is, not to treat it with a medication, a pain medication, or anything like that, because I didn't want to stay on pain medications, but that were dedicated to figuring out what was going on with me. And so at the top of the year, I got new insurance, which would help cover some of these health visits and imaging that I had to get done. And so we're still in that process right now. I have gotten some of the results back. We're thinking that there are some nerves that are getting compressed based on my anatomy in terms of my posture and everything. He also told me that I am hypermobile in some of my joints in the lower extremities. Because of all of that, some of the muscles are tense because they're trying to stabilize the joint. And so some are tense and some are loose and some are weak. The nerves that are going through the pelvis are getting irritated. And so we learned in medical school that typically when someone has symptoms or they have some problem, it's usually caused by one thing. But I found in this whole journey, in terms of learning about the pelvic floor, that it can definitely be very complex. And so some of the symptoms that women are having are not just related to one thing. For example, for me, I had what's called hormone mediated vulvodynia. I also had pudendal neuralgia, meaning the pudendal nerve is irritated or compressed in some way as it's going through the pelvis from the spine out and through the pelvis. But then I also have a tense pelvic floor related to a life history of holding my bladder and constipation. And so I say all of this because a large majority of us are constipated. A large majority of us in healthcare, we are so busy, and in some of our fields, we don't have the opportunity to go to the bathroom when, we get that first sense to go to the bathroom. So we are putting so much pressure on a pelvic floor and we don't even know it. And then also, most of us, we sit a lot. And so our glute muscles are weak. And so the opposing muscles, you have some that are tense and some that are weak. They're fighting each other for the joint to be stable. And that can cause a lot of pain in the pelvic floor. And so, again, through all of these doctors, I've learned a tons of information about the pelvic floor. Dr. Balani introduced me to ISHWISH, which I always get the name wrong in terms of what it stands for, but it stands for the International Society for the Study of Women's Sexual Health. And I've learned so much in terms of treating the pelvic floor and all of those things. And from this experience, I would say it was important for me that I felt validated. And so that's something that if I learned anything from this, if I didn't listen enough, I feel like what I've learned is to listen more to my patients. Even if, sometimes we don't have all the answers, there still may be something happening. It may not. Some of it might be in your head, but it might not all be in your head. There might be something there, that is causing you to have pain. And so sometimes it's just going to take you finding the right providers to help you find the root cause of what's happening. And there are doctors out there to do that. And so in learning all of this information, Dr. Balani was like, "Oh, you need to do this. You need to be a pelvic pain specialist just like I am." But at the time she didn't know I had already started building this uh business already. So I'm like, I can't jump into another business, but what how can I use my own experience and bring it to this podcast, because I know, or I found that there are so many women and men that are dealing with pelvic pain, um, that are having painful sex because they haven't brought it to their doctor and they're suffering in silence. And we don't have to suffer. There's so many treatments to help people. There's so many levels to it. And yes, it is complex, but there are definitely specialists out there that have teams of different doctors, just like Dr. Balani has her team of specialists that, once she does her part and she thinks there's something else going on, she'll send you to another person in her team that will help figure out what's happening to you. So if I could say anything, I would say listen louder to your patients, validate the problems that they're having, and try as much as possible, as I said, to give them your best. And if you don't know what's happening, don't just dismiss them and their pain, especially if it's someone who has pain or chronic pain. Don't dismiss them, but say we'll work through it. And if I don't know what's happening, we'll find out what it is. If you are learning anything or any of this information is resonating with you, please hit the like button and let me know how you're feeling in the comments. All right, so next question. Why did you decide on the Unspoken Medicine podcast? So I would say probably back in 2017, like 2017, 2018, I was having lunch with my physician mentor, Dr. Barbara Jones, and I think we were just talking about medicine, and I was just getting really frustrating with the way medicine felt. I probably was like feeling a little bit of burnout probably around that time. And it just didn't seem like the medicine that I wanted to be a part of, that I fell in love with. Even though I was helping women in terms of their sexual health and all of that, I just felt like there was just so many other things that I felt got into the way of us taking care of patients. So we were having a conversation, and I was kind of talking to her about, like, how are things different? Like, how did you last this long in medicine? And so at the time, I had the name for the Unspoken Medicine. I had the name. There was going to be a volume 1 and a volume 2. It was going to be from the patient's perspective, but then from the healthcare professional's perspective about what medicine was. So many things were going on. I was like, okay, I'm going to write this book, because as I told you, I was good at writing. I'm going to write this book. I'm going to interview people. I'm going to write this book. And then COVID happened. And COVID changed a ton of things. I'm sure everyone has their story about what happened to them during COVID. But we came out of COVID, and I just feel like we just went right back to business as usual. COVID was really hard on a lot of us. And I mean, we lost like families, we lost friends. It was almost like COVID exacerbated all of the problems with our physical health, but also our mental health. And so it was hard for me because I couldn't just unsee the gaps in our healthcare system in terms of the infrastructure. And as I said, I feel like we kind of just went back to business as usual. We had the same demands or more demands, but we had less staff. Many of us just felt like we weren't being valued. You had several people that left healthcare. We didn't look at the people who died. Why did they die? Like, what part did we as medicine, as healthcare, Like, what part did we play in this? How could we have prevented, these deaths? How do we prevent it from happening again? What about like the mental health disparities and access to mental health specialists that happened, and the need, even more so than that? Per a 2020 review in the International Journal of Infectious Disease, chronic comorbidities, including obesity, hypertension, diabetes, cardiovascular disease, cerebrovascular disease, respiratory disease, kidney disease, and malignancy were clinical risk factors for having a severe or a fatal outcome associated with COVID-19, with obesity being the most prevalent and respiratory disease being the most strongly predictive. And so the pharmaceuticals, they jumped all over this. They jumped all over making anti-obesity medications. And so while we were dealing with the physical component of obesity, we kind of forgot to take care of the mental component of the disease, which I personally feel is the most important part of the transformation. Um, and so to me, just felt like there was no strategy to correct the gaps in healthcare that we had before COVID, let alone the gaps that occurred after, based on many of the decisions um, that were created from it. So in 2022, I went back to school to graduate school at Brandeis University to get my executive master's in business administration through the Heller School of Social Policy and Management, with 30 plus other physicians from around the world in the middle of the pandemic. And for the only time in my life, under the late Professor John Chilingerian, I felt that I had really met and been surrounded by my tribe of people who were literally just like me, physicians who basically were desperate to see a change um, in our first love, which was medicine, and not just a change in the quality of medicine that we gave, but the operations and the management of medicine. And we understood that it started with us. Um, because if you guys haven't realized, no one is coming to save us. And we literally have to be the change that we want to see. So, this podcast, I want to use to connect like minded people that want to change our industry, but also want us to become the healthiest versions of ourselves. Okay, so if you gave me $1 million, how would I change medicine? I would want to increase awareness to the fourth trimester, which I consider the postpartum period. I don't think we do a great job in terms of taking care of our postpartum moms. And so I will want to provide additional services um, to taking care of moms through mental and physical recovery. I am currently trying to work through putting in place processes that would help prevent postpartum hemorrhage. And I would want to do that through prevention, particularly in adequately treating undiagnosed anemia in reproductive women. Also, I would put additional money toward diabetes and hypertension prevention. I have diabetes on one side and hypertension on the other side of my family. So it's important for me that we do more in terms of diabetes and hypertension prevention. So I'm gonna need a few $1 million because I got a lot of stuff to do. And if I gave you $1 billion to change the world, how would you change the world? I would create a soap that eliminates sugar addiction, and then I would create a lotion that allows people to solve conflicts. in just a fair, just way. We need more conflict resolution in the world. So those are the things I would do. All right. And now it's time for our silent prescription. So with each episode, we will have what's called a silent prescription. And it is basically what are the things that I want the community to take home from each episode. So I have a few here, so get ready. So the first one, again, is to my peers in healthcare. Some of us call the lazy peers, meaning that we just work a lot. And honestly, it is an occupational hazard in terms of what we do because we're working, we're moving around so much, we're taking care of our patients, but honestly, we're not taking care of ourselves, we're not taking care of our bladders. So we need to do a better job. So I definitely teach my patients a lot about bladder retraining, especially because they got Foley catheters in their bladders. It can be very sensitive coming out, or you just had a baby. Some women can have incontinence or pee on themselves because of there's so much happening and it's in a dynamic state at the time. So I definitely recommend bladder retraining, and in terms of doing that, I just tell people make sure they stay hydrated with water as much as possible, and at least try to get 2 liters of water in throughout the day, but also making sure that you're emptying your bladder every few hours. So every 2 to 3 hours, you just want to go to the bathroom. And it's just to get that any extra pressure off your bladder after the trauma is it's just been through. And as I said, it's normal to void every 2 to 3 hours if you're adequately hydrating. The second thing would be to eliminate constipation. So if you definitely are diagnosed with a hypertonic pelvic floor, or you have pelvic pain for any reason, it's so important to not be constipated because that's just extra pressure in your pelvis. That's not necessary, right? And so how do we prevent constipation? That's through having adequate hydration throughout the day and fiber, right? And so you need to drink water throughout the day, okay? And also incorporate fiber throughout the day so that you have the best kind of stool consistency. And so how I kind of think about it and how I tell my patients is it's almost like you're kind of creating a dough, and so you're mixing the wet and dry to get a good consistency for the dough. So in similar manner, you want to drink through water throughout the day while you're eating so that you have a good consistency. In terms of the fiber, you want to increase fruits and vegetables in your diet, green leafy vegetables, whatever your favorites is. Just include that in your diet. I love to also add chia seeds, but just having more fruits and vegetables in your diet. I also talked already about movement, right? So we say motion is lotion for your joints. So you want to be able to move around. And I honestly think that maintaining your mobility is really the prescription of life. You can see as people get older, they don't move as much, and then that's when their joints get stiff, that's when they break their hips and all those type of things, and they go down that path. So it's important as much as you can through your life to maintain your mobility. Dr. Sieferman told me, he was like, there's not a day, because of my hypermobility in my joints, there's not a day that I don't stretch anymore. Like there can't be another day that I don't stretch every day, that I'm moving my joints in full range so that I am conditioning those muscles, including also doing strengthening, but you also want to do some conditioning through stretching as well. And so I said that if we have a specialty called pain medicine and rehab, and if you can teach me how to rehab, then you can also teach me how to stay mobile, right? And so I think that that is definitely a gap in our healthcare that we need to add. We should be teaching more prevention in terms of how to stay mobile, how to stay conditioned. And then the other one that I wanted to talk about is, especially if you have pelvic pain, but I just think in general, everyone should just try to protect your pelvic floor as much as possible. As I said, pelvic pain can be complex. It can take multiple providers to kind of figure out what's happening with you. So it can be frustrating, but you have to stay encouraged that you will find somebody. Find somebody that will listen to you, that will validate what's happening to you in terms of what you're feeling and your symptoms, that will go through the process with you. Some of the things that I've learned in this last year, I found that with pelvic pain, sometimes the root cause is not necessarily in the pelvis. Sometimes you have to look up and sometimes you have to look down to see what dynamics are happening that can be causing pain in the pelvis. A lot of people shy away from people that have pelvic pain, but and they say, it's all in your head. Now, some of it is, as I said, there's this biopsychosocial model, right? So you have to look at what's the biology that we're seeing, but sometimes because of the biology, you know, we can stress ourselves out more, where now our sensory for pain is elevated, which makes the biology worse. And so it's a whole cycle that can happen. So it's important to let's look at the biology, look, what can you find, but also look at the person's lifestyle, and you can find out a lot about what might be happening based on their lifestyle. One of the other things I found, that because I drive a lot in terms of when I go to work, I found that I have to take more breaks. So, after an hour or so, if I'm doing a long drive, I'll take a break, after an hour, just to stretch my body, stretch my back, stretch my legs. Um, and try as much as possible to activate the glutes, because when we're sitting for so long, our hip flexors are taking over, and our glutes are the opposing muscles on the posterior side, on the back side of us. So you have to have some balance within that. I found a book, and I can't think of the name of it right now, where I was reading in terms of that hip flexor kind of always being on, especially when we drive, that you want to extend the angle in between. So like if you're sitting in the car like this, this is your torso and these are your legs down here. You want to extend this angle as much as possible. Be mindful of like how you're sitting. You don't want your knees to be above your hips when you're driving, because that just causes all that tension right in there in the pelvic joint. So you want to actually have your knees below your hips, which gives a little bit more space there for there not to be as much tension. How I've done that is in my vehicle, I have elevated the seat so that, and then kind of push it back a little bit, so that I can have that extended angle within the hip joint. Oh, this is a good one. When you get out of bed, I want you to look back and see if there's someone still laying in your bed. If you still have an indent in your bed that looks like somebody's still sleeping in your bed, you might want to check how long you've had that mattress. That mattress might be, exacerbating the pain that you're having in your pelvis. And so that was something that I had to do. My mattress was getting close to it, its life, its life cycle. And I was like, I think I need to get a new mattress. So I just got a new mattress. I'm very excited. I feel so much better in the new mattress. I'm sleeping better. I want to tell you guys the name of the mattress, but I'm so nervous that if I tell you, it's I'm just not gonna sleep well. So I'm gonna give it a little bit more time, and I'll be back to you to tell you how I'm doing with this mattress. But I'm very excited. I'm very optimistic. I mean, how I've slept in the last several days with it, because I literally just got it. I'm very hopeful. I'm very excited for it. Okay, what else do I got for you? Oh, yes, this is a good one. Be mindful of how are you sitting when you poop. For decades, we've been telling women to push like they're pooping, but we've actually been pooping wrong. And so you should be sitting with your knees elevated above your hips. and you can do it kind of with a slight bend forward. This is the squatting position that's going to make it easier for you to poop. When I was in med school, one of the colorectal surgeons that I work with, she would always say, don't sit on the toilet for more than 2 to 5 minutes, because you don't want to be straining, but you also don't want to be in that position that can cause more pressure on the rectum or the anus, or if you have hemorrhoids, make your hemorrhoids worse. So if the poop has not come out within 2 to 5 minutes, you need to get up because it's not coming out. I think the combination of drinking the right amount of water, fiber in your diet, changing your diet, moving, and then when you're pooping, you want to sit in that right position. Now you can get a stool of any kind. It doesn't have to be any specific brand. You can just go to your local hardware store, wherever, and get a stool, but make sure you're sitting with your knees elevated above your hips. And then do what people may know it to be called as diaphragmatic breathing or belly breathing. And so this is the breathing that I learned from physical therapists. People also use it for mindfulness, meditation. Basically, what you want to do is you want to exhale as twice as long as you inhale. So, say for example, you inhale for 4 seconds, you're exhaling for 8 seconds, and so inhaling like you're breathing in you're inhaling like you're smelling the roses, and exhaling like you're blowing out the candles. And so in the process of exhaling, you want to blow out through your mouth. So exhaling like you're blowing out the candles. But while you're doing that, you're trying to tuck your tummy or your belly button into your spine. Okay. And then while you're doing that motion, you are opening up the pelvic floor. So relaxing the pelvic floor. And so this whole process that I'm talking about, it definitely takes time to learn, because you have to unlearn how you've been pooping for your whole entire life. But definitely once you get the hang of it, like, it's it's perfect. You're gonna come back and say, thank you, Dr. Colgram, for uh teaching me how to poop. I guess then the last thing I would want to say is, this just goes back to myself from the beginning. I would just say invest in a child. I would say continue to believe in them, continue to believe in their dreams, give them hope despite their surroundings, that they can be whatever they want to be. I say that I'm definitely a product of that unspoken medicine. And I feel like my life is, how you say it, probably one of the best examples of to be successful against all of the odds. I will say, if God is telling you to do something, then you just need to get up and do it and move on faith. That's how I feel just with doing this podcast. Despite my fears of coming in front of the camera, I know that I have information that's needed, that needs to be heard, especially in this time. And I'm excited that I can bring to you some of my good dear friends, people that I even call family, that can share with you the knowledge that you need to be your best self. And I'm talking not just physically, but spiritually and mentally. It's definitely something that we all need right now. Um, and so I'm just excited. I'm excited for the future of what we're going to do here. I've had this vision, as I said, to help people on the largest scale. Never in my wildest dreams that I thought that I would ever be doing this, but I believe that this podcast, the Unspoken Medicine podcast, is just the beginning of this journey. And I'm very excited about it. I'm very excited about it. All right. So, in conclusion, I'm so excited that we got through episode 1. I hope that you learned something. I hope that my own health story can inspire many women and men to take care of themselves. Go find a doctor that will listen to you, that will validate your concerns. And I'm excited that through this podcast, I'm definitely going to introduce you to so many people in the world that are doing this work. Thank you for showing up today. let me know how you're feeling down in the comments. Wherever you're listening on your favorite podcast and streaming service, thank you for being here. And I can't wait to see you on the next episode. Today and every day, let our actions speak to the good medicine that lives inside of us. I want you guys to be well and be blessed. And I'll see you on the next one. Take care. Bye.